Hi everyone, my name is Shahid Mohammed. I'm here at the American Society of Nephrology, and it's a fantastic arena to be in, and here to be also excited to meet my colleague Natalia Kopenko from Renal Mate. We are presenting this work from a three-way collaboration, which is fantastic, and Natalia, tell us a bit more.
So I'm very thrilled to be here, and it's been a really fascinating and wonderful conversation we had during this conference already. How this collaborative work can improve the lives of CKD patients, and some of our outcomes we are presenting, how just within 6 weeks of intervention, patients were able to improve their weight, stress, sleep, and strength, as well as feel most important.
That's amazing. And again, this is really exciting because we're coming from a three-way collaboration. From an academic perspective, we're coming from the Renal Mate tech app perspective, and also fantastic collaborative work from the Renal Patient Support Group. And it's really phenomenal to be in this arena with academic scientists and clinicians. So we hope you can join us, or at least take a look at our poster. We're at P0599. Thank you.
Thank you.
Hi everyone, my name is Shahid Mohammed. I want to just provide you a presentation that myself and colleagues with Renal Mate and the Renal Patient Support Group worked on collaboratively to highlight an initiative and perspective on weight loss, improved diet, sleep and strength among chronic kidney disease patients following a 6-week app intervention with personalized mentoring or coaching. And this is truly an international collaborative effort where myself representing from the University of West of England and colleagues at Renal Mate and the Renal Patient Support Group worked quite tirelessly really to highlight how technology and mentoring or coaching can really empower the lives of patients. Kidney disease is a long-term irreversible condition that affects approximately about 14% of the general population in the United States. CKD is a growing concern internationally, and that has been highlighted in papers quite far and wide. CKD influences cardiovascular issues or concerns in patients with the disease for a very long time. Anemia or hemoglobin problems, malnourishment or nutritional issues or deficits, strength degeneration or even muscle integrity concerns, various biochemistry imbalances and problems with different laboratory parameters, bone density and osteoporosis, fractures where bone problems are concerned. Additionally, up to 1/3 of CKD patients suffer depression, and I think we can all agree that psychological issues or can be psychological concerns in patients across the board, and for CKD patients or adhering to medicines can be a problem. And lifestyle is also critical for maintaining the quality of life. A good lifestyle is critical for maintaining quality of life. Yet few studies have actually focused on methods to maintain patients' adherence. In addition, obviously there's the American Kidney Fund have published some summarized data relating to a survey they carried out back in March 2018. So the objectives or the aims of this work are three. Number one, to evaluate exercise, diet, stress, and sleep management in hemodialysis and CKD patient cohorts. Number two is to outline the outcomes of the Renal Mate program, and my colleague Natalia will pick up on that in a bit. And number three is to provide supplementary educational support surrounding hematological and biochemical parameters following their participation in this program. I also want to provide a quick background on the RPSG, or the Renal Patient Support Group. So it's an international support group, and it has been set up or initiated since 2009, and it has been really a driving force for patients and carers to really become more empowered about some of the decisions that they need to make around the elements of their care. And it's basically a platform where research is driven, and the awareness of CKD, or kidney disease, becomes more widespread through various social media platforms. And this is also achieved through attending different events and presenting at different events. The group has over 8,000 members internationally at present, and I think that's quite an interesting story, just telling that the social media space, or internet space, has a real encouraging platform for those patients, especially the hard to reach populations who might feel disengaged otherwise. So I'm going to pass you on now to Natalia, who's going to tell you about the Renal Mate perspective and their solution to support patients, and she's going to give you hopefully a highlight around the aims of objectives of that work. Thank you.
Thank you so much, Shahid. And RenalMate is really appreciated for this international collaboration, and we are thrilled to be here at ASN Kidney Week 2019. I would like to share with you some background about the RenalMate. We are a California-based company, and we designed the CKD management solution to help patients, caregivers, and healthcare team to improve patients' outcomes. Our solution design in patient-centric approach, providing their mobile technology facing patients, where they will be able to manage their data tracking, self-reporting, receive necessary assessments and surveys. This platform also offers the dashboards that are facing medical team and caregivers that allow them to receive efficient reporting, more efficient communication, and provide a better way to monitor and guide patients. The aims and objectives of this work were to develop personalized plan to improve kidney disease management and adherence, and enhance overall quality of life of renal patients within 6 weeks. The program used motivational interviewing and SMART goal settings, cited Agera 2018. This was achieved by implementing bi-weekly patients receiving CKD education on the following topics: renal diet and CKD education based on stages and comorbidities such as diabetes, healthy eating habits aligned with recommended nutrition for CKD stages, stress management and mindfulness, sleeping hygiene, monitoring the sleeping pattern and receiving feedback, physical activity, implementing low-impact training, strength training among CKD participants, and laboratory parameters, understanding surrounding CKD tests and interventions. As well as the weekly accountability mentoring session was implemented in this program that provided patients with a weekly updated health report that made them empowered and acknowledged with their progress. RenalMate was used for the patient's remote monitoring with the self-reporting, and RenalMate app provided online community where patients were able to share their successfully achieved activities or some personalized reflections. Demographics of the population of the program was the following: 1 post-transplant patient, 1 CKD post-transplant, 3 patients were CKD stage 3, 1 patient CKD stage 4, 2 patients were ESRD hemodialysis, and 1 patient ESRD peritoneal dialysis. As you can see in the schematics, the age range of the participants, the dominating amount of patients were in the age range from 30 to 39, and the second dominating group were patients in a group of 40 to 49. The results of analysis before and after mentoring program via RenalMate app were the following. The participants from the program improved their strengths in 89% of participants, while 11% remained the same, while increasing workout time and endurance. Energy level-wise, 89% of participants reported feeling more restful and increased energy level. Sleep quality improved in 89% of participants who kept healthy level of sleep of 7 to 8 hours, while 11 maintained sleep level at 6 hours. Weight loss was reported among participants within 78% of participants reported weight loss, and 11% of participants remained the same weight within BMI 30 to 34.9, while 11% of participants who haven't lost the weight had a BMI within normal range. The following outcomes were identified through the program, providing remote monitoring and mentoring. Assessment and personalized adherence plan, activity and cardio routine that was approved by care team, diet management for CKD several stages, stress management with mindful practices, sleep patterns and sleep hygiene analysis, as well as recommendations for improvement of sleep management, personalized nutrition and habit management, helping patients to understand their snacking pattern, better practices on food shopping and eating out, as well as a long-term plan providing patients physical activity, nutrition plan, and additional renal education that would help them to maintain their adherence. The outcomes identified and consistent with the importance of monitoring CKD health stated in multiple papers.
Thank you, Natalia, for that nice summary of what the RenalMate app offers, and it's clear that it could be advantageous for several groups of stages of CKD, prompting self-care as well. So just in summary, the combination of self-reporting, comprehensive data tracking, specialized social app, and weekly teleconferences with mentors or coaches represents a sort of a novel and scalable approach to CKD health. And I think with the way technology and the internet is offering information to patients and even carers nowadays, it seems that apps is the next way forward. Although this it is quite transparent that unfortunately, owing to the limited sample size or small sample size, there's various limitations, but it's quite clear that participants improved in both quantitative and qualitative measures of health. That future studies probably should expand on the role of education and long-term impact of such programs, involving and inviting wider multidisciplinary teams or members of teams to get involved in such initiatives. For example, healthcare scientists to provide CKD education surrounding the different laboratory tests and investigation that surround this long-term condition. These could replace traditional MDT meetings to support CKD patients more widely. And certainly wider collaborative working highlights is that future studies probably should expand on the role of education and long-term impact of such programs, involving and inviting wider multidisciplinary teams or members of teams to get involved in such initiatives. For example, healthcare scientists to provide CKD education surrounding the different laboratory tests and investigation that surround this long-term condition. Equally, digital group consultations seem to be quite advanced in some parts of the world, and these could replace traditional MDT meetings to support CKD patients more widely. And certainly wider collaborative working would improve activity levels, support patients with appropriate sleep guidance, health and nutrition aspects again around their different elements of health, increase motivational levels across CKD stages and severity. And with that, I thank you for going through our work, and if you have any further questions or queries, please feel free to contact either one of us about this work. Thank you.